Diabetes has greatly impacted our life, and from 1998, when our son was first diagnosed with type 1 diabetes, certainly our lives have changed. And it was a result of one day in April when he came off the soccer fields. He was feeling a little more nauseous, a little more tired, headachy, a little more thirsty than I guess than usual. The next morning when we went to the Children's Hospital, it was great. The endocrinology clinic, the people there were absolutely fantastic. The endocrinologist, the diabetes educators, the dietitian, that whole team helped us manage that first week of setting up a schedule, letting us know what it meant for dosing of insulins, what foods to eat. Not that I wish this on anybody else, but if any child has to have diabetes, then having it in a major Canadian city where there's a children's hospital as good as CHEO is certainly the best place to be, because that 1 week provided him with a great basis on how to manage his diabetes. An area where we were quite concerned was he was now going back to school. And he was different than he was the week before he had taken the week off. And we were quite concerned as to how this would affect him. As it turned out, we were very fortunate again. One of his teachers had type 1 diabetes. And with his reinforcement of our comments to him was, you can do anything you want and diabetes doesn't have to slow you down. I think the charter is very important on several levels. One, even though we live in a great country, it still matters where you live in Canada if you have diabetes. What the charter clearly indicates is that basically what it does, it summarizes the roles and responsibilities of all the players that then will help the person who's living with diabetes manage it much better. The other thing it does is it lists the responsibilities, and I think this is the key point of the charter. Everybody is responsible for a portion of the management of diabetes, and so it's not just another document of patients wanting more and demanding more to be provided for them. It shows that they are also responsible for, if all the other players do what they're supposed to do, the patient is then responsible to go and get the help that they do need. So I think that's a very important message in the charter. It also provides a baseline for people to advocate for themselves. They can now know what various people are responsible for. And I think what the charter does is it will help someone who has diabetes manage their diabetes and not have diabetes manage them. And in many cases, diabetes does manage people. They let it manage them. I think the charter will help people manage their disease so that they can live a full and fruitful life.